Good afternoon, Will Sullivan, CM&F Group, and we've got Taking Your Shot, the entrepreneurial PA. We did this panel yesterday with 3 different panelists. It was phenomenal and really great perspectives. And today we've got a new panel, a new set crew here. We're going to go through 3 quick questions, and then that'll take up about 30 minutes, we're thinking. And then we'll have 15 minutes of open Q&A. So we'll just walk around with a microphone, ask any questions you have. We've got some questions of our own that I'm sure we can pop up there for you all. But we'll just get going from there. So one thing for CM&F Group, and we throw this slide on, we've been a long time partner with the AAPA for malpractice insurance for almost 30 years now as an endorsed provider. Do everything from students to businesses. One of the things we kind of see is that transition of PAs into the entrepreneurial role. So we just kind of pop it up here for key business insurance considerations. We're the med mal and professional liability, but either ourselves or our sister companies do everything from disaster preparedness to cyber insurance. One of the attendees yesterday who consults on business startups was actually saying he had a friend who started a business and was immediately, after 8 months, had a breach and has been trying to recoup his funding after that. Whereas, other folks have cyber insurance already kind of built in. So just different considerations that you want to keep in mind. Won't take too much of your time on that. We really want to get into like the meat and potatoes of why we're here, which is really what we see at CM&F Group is just so many PAs contacting us for sole proprietorships or jointly setting up businesses with physicians that they've been working with or with a nurse practitioner. We're seeing this kind of go across the country, and it's just really the beginning of a wave that we really find is meaningful to get more thought leadership out here highlighting for you all. The big branding is, PAs go beyond. And I think when you look at the metrics and you talk to the AAPA leadership, 40% of the professionals in the PA profession want to go into leadership positions. 40% of students want to go into leadership positions. So the entrepreneurial path is right in line with that, and it's really meaningful to kind of get going. So we'll just kick it off here, and we'll just have everybody introduce themselves briefly, and then we'll kick it into the first question. So go ahead, Karen.
Hi, I'm Carrie Hodge, and I'm CEO and co-founder of Denver Health. Hi everyone, I'm Raquel Akman, and I'm the president and founder of PA Moms.
Good afternoon. This is not on. Can you hear me now? All right. Kevin Rittelberger. I am the co-founder of a company called Dispatch Health.
Hi everyone, good afternoon. I'm Carrie Tao. I'm CEO and founder of Renew RX, a PA, a mama, and also a professionally trained chef with a nutritional focus.
A lot of flair when you get the professionally trained chef. That's a very vital point, part of that, which is amazing. So the first question is, what inspired you to pursue an entrepreneurial path, and how did you identify the opportunity? So kick it right in, Carrie.
I think I have never been really good at a 9 to 5, and if I was someone that had to clock in and out of a job, I think I'd be fired very quickly. But I was in a leadership position very fast after starting as an ER PA back in 2006, and just very much always saw problems that I wanted to fix in healthcare. And I think it was after I actually struggled with my own health problems. I had breast cancer actually twice, and it was after my second one where I spent about 8 months in treatment sitting on my couch. I realized how fleeting time was, and I was just tired of waiting for permission to get out there and get things going. And honestly, the fear of not trying outweighed the fear of failing, and I was like, it's time to go out there and try hard things. And I took a jump into the world of startup and just fell in love, and that's how I got started.
So how did you just, Carrie, just to add one more, how did you identify the opportunity with Denver Health?
So at Denver Health, we are building a new specialty, bridging the gap between the discharge from the medical care team, and we're doing that both with our medical practice and the software that we're building. And my years in the ER, just receiving these patients back, I actually was thinking about writing a blog called "If Only," like if only they'd gotten the antibiotics a couple of days ago, or if only someone had been able to see them yesterday. After years of seeing that, knowing that if only we had gotten to them sooner, we could have avoided that readmission or that failure or that exacerbation of their disease. And when I actually started working for another startup, I started doing some work there and getting really great outcomes, and I became obsessed with it, and I knew that was where we needed to build.
Amazing. Yeah, Raquel.
So I never planned on being an entrepreneur at all. If you know me and my husband, you would probably think it would be my husband that would do that, so I fell into this pretty much by mistake. I was a neurosurgical PA and a lead PA at the Bronx Surgical Medical Center, and had my daughter. She was about like 2-ish, and I was one of the only moms that I was friends with that was a PA. I had no one to really turn to, and one of my colleagues was a physician. She was telling me all about this physician moms group that she had online, and I was like, there has to be a group for PA moms. And I went online, and there was a group, and there was one lady in it. She never started it, so I messaged her, and I was like, hey, I see you have this group. I don't want to start a new one if you're planning on doing something with it. And we got together, and we started it. And I never thought that it would be as big as it is today, as influential as it is today. Never thought I'd be running a big organization, but honestly couldn't do it without my team. So it was really a need that, it was out of my own need that I built this group, and it's so beautiful. So I identified the opportunity for my own need of needing support and camaraderie within my profession, and just really excited about the future of PA Moms. So.
Yeah, great. Kevin?
I was a practicing PA for about a decade or so, and had a lot of great mentors in private practice associated with practice roll-ups, and really thinking about the business aspects, of practice management, and was always very intrigued as to why it occurred, but really didn't understand exactly how the money flowed from one entity to another. And so that was one aspect of how I got into it. Another aspect, was seeing so many problems in the healthcare space. So I'm sure all of you, every day when you are showing up for work, seeing patients in the clinic setting or in the community hospital setting, you are asking, why do we do it this way? This is such a struggle. And that was me, too, as to questioning all these different processes and technology solutions that were handed, to me. And I started to raise my hand to a lot of different committees at the hospitals I was on staff at, just to get involved, to learn, and to be able to make connections with the different hospital administrators and different leaders, whether it be in the nursing side or the administrative side, and still really didn't have a path exactly what I wanted to do. And so I went back to business school while I was still practicing, really to learn more, really having no ambition as to what I was going to do with that, but just wanting to learn. And I had an opportunity to be introduced to a couple of local entrepreneurs who are both ER docs here in Denver, Colorado, that were starting a company when the iPhone and the Android phones were coming out. And they built a smartphone app when apps were like really cool and people were trying to engage in these mobile apps. And that app was directing patients to the appropriate level of care based on their symptoms. And we had a lot of great success. Well, I jumped ahead there. I joined that company because I really was bought into the mission that they were delivering. And I really didn't want to lose sight being able to impact patients and impact kind of the path that patients were going down. And when I joined that company, we had some great success, and I fell in love with the interplay of technology and being able to change the course, really, of healthcare. And along the way, we were acquired by Aetna, the insurance company, and saw an opportunity to be able to build a new company called Dispatch Health that was able to meet patients where they're at, and that was in the home setting for acute medical needs that didn't need to go into the emergency department. And so we started in the ER space, substitution space, worked on transitional care space, hospital-home models, scaled it across the country, and now I will never do anything else than work in kind of the startup, company building, phase. But it all has to be in healthcare, has to be mission-oriented, and it has to impact, patients in a positive way.
Yeah, okay.
Wow, what an honor to be with you guys. So, quick question. Take off your PA hats, your PA student hats. How many of you have gone to the doctor in the past couple of years? Raise your hand. Okay, now keep your hand up if during that visit someone's talked to you about concrete things you can do to actually improve your lifestyle and nutrition to reach your health goals. Okay, so this is why I created what I did, is because not many of us have our hands up. And I'm not sure about you, but I got 3 hours of training in nutrition. It was not adequate. So as a provider, I was working mostly with uninsured, underinsured, primarily Spanish-speaking population. And it was my dream job. I would stay super late. I knew janitorial staff and all the drama going on in Daniel's life with the security detail and all of his personal stuff. And there was a lot happening that in order to care for these patients. And like so many of us, I burnt myself out, just as we all do. And when there was an opportunity to go into patients' homes and really get an hour with a patient, with a case manager, I jumped. And for me, that was the moment that I realized as providers, we're really setting the destination of health, but we don't actually give patients that specific roadmap to get there. And when I'm recommending to a patient to go on a walk and they don't have a sidewalk, or I'm talking to them about eating healthy food and they don't really understand much about nutrition, or in their family, there's so many different dietary needs that they're trying to meet, that they're prioritizing themselves last, that I realized that each patient really needs a custom program for them to succeed. And specifically something that's behavior-based that can give them real-time feedback. And then when COVID hit, and I wasn't able to do home visits anymore, and I was furloughed, and I had 2 young children at home, I decided to go back to school and become a professional chef with a nutritional focus. Because I think like so many of us, we see food as medicine and really in preventing chronic problems. Yet, because we don't have the real tools to recommend it to patients, we don't. And I really wanted to find a way to change that. And after ultimately a lot of soul searching and then culminating in a conversation with my sister and hearing about her struggles when she had gestational diabetes and was diagnosed and had, now twice the number of doctor's appointments, poking her finger 4 times a day, and completely overhauling her nutrition overnight, that's when I realized that when she previously had asked me for help, I didn't give her that nutritional support that she really needed. And honestly, it broke my heart. So we created RenewRx, which is a patient app, a medical provider dashboard, and then tech-enabled coaching that works in collaboration with the medical office. So how it works is a patient's wearing a continuous glucose monitor, tracking their food with AI, and then using our curated programs that we've created, where it's based on the patient's behavior to ultimately drive change. And so for patients with diabetes and pregnancy, now it allows them to really see real time the impact of what they're doing and what they're eating, and small little changes that we can renew rather than replace what they're doing. So for instance, if we're seeing that they're having challenges in improving vegetables intake, this week we'll be focused on that, and we'll look at what's going on with the local groceries and help find ways to make sure that this is not an expensive And we've been able to find a way also to get this all fully covered by insurance and generate new revenue for the practice. So eventually we'll expand beyond pregnancy, but that's where we are right now.
Yeah, so just, I mean, it's amazing hearing everybody's story, and yesterday what we heard is just problems people have that they want to go out and solve. And that was really like the impetus of starting something new. And one of the comments made was, if people come to you for a certain problem to solve, and it's just innately something that it's like your secret sauce, that, and then there's a problem that you can solve, it's like a good starting point for a business that you want to start. But yeah, let's get into biggest challenges that you face. If each of you could just give one of them that you found.
Well, I think every day in startups and starting business is like another huge challenge, and I think part of it is why I love it. I think the problems that I think all of us are trying to fix are really complicated, challenging problems. Even just face-to-face with a patient, like when you're all taking care of people at the bedside, you know, people come in front of us and they're four-dimensional, there's a lot going on with them, and trying to get through and fix whatever problems in front of you is complicated. And so taking on a whole system of change is, you know, trying to put together a really, really complicated puzzle. So I think just getting started is hard. I think for me there was, I think, a barrier. I think just with the PA, just being a PA, I think at one point waiting for permission to do things. And I finally got over that hump of, you know, I'm not gonna wait, I'm just gonna go. I do have a really wonderful co-founder who has some experience in startup, and so it was really great to have someone that was able to navigate the road of like, now we need to go get venture funding, and how do you do that? And you know, that was like, taking that leap was really, really hard. And I think it was just the first step was the hardest part, but once my feet started moving, you know, just putting one foot in front of the other, and you know, every day there's a new challenge there, but it's like super invigorating, it's super fun, and you know, we have this great mission, and what we're doing and what we're working towards is so inspiring to all of us, and I think that's what keeps us going. So
Yeah, we go.
So I'll kind of continue telling you the story of PA Moms. So we started as a Facebook group in 2016, and during COVID in 2020, I had a little bit of a lull in my surgery career because they weren't doing a lot of surgeries anymore. And so that's when I had the idea to create a special interest group with PA Moms, making this Facebook group a real organization where we can actually make do advocacy, do scholarships and change. So I kind of took the leap, made it an organization, went through AAPA to become a special interest group and constituent organization. And we have a leadership team on PA Moms. They help with various things, but they have the literal hardest job, which is to make sure the group culture stays healthy. It's really difficult online because sometimes people don't stay professional. They can get a little bit mean, and so our team is working 24/7 and working on the group. And then there's also obviously the organizational part of it, the finances, the social media. There's everything that goes into running an organization, PR, advertising, everything, running the conferences. And I was a new leader, and my biggest challenge really was leading my team. And I would say, you know, I also had a stroke in 2020, and so I guess that kind of was part of this. I woke up and realized, like, wow, I have to lead a team now, and I have to learn how to be an effective leader. So that was my biggest challenge, how to become an effective leader and be able to keep that camaraderie on my team, not only in the PA group, keep the culture good on my team. And so I actually got a leadership coach, an executive coach, and she's freaking awesome. And I worked with her for over a year. I'm still working with her, but less often now, and it has helped me tremendously. I also went back back to school at the University of Lynchburg. I got my doctorate of medical science, and my concentration was in medical education, but they have great leadership courses there, and so I kind of tied the two together, the leadership coaching, and I really did some like real introspection, and really got down to, number one, walk my like moral compass of my values of why I'm doing this. And especially after my stroke, I realized that, this is more story to you, that I realized that, you know, life is about doing what makes you the most happy. And so you have to really look inside and find out, you know, what makes you happy. And so that will guide you if you're looking to do any kind of business or entrepreneur opportunities. Really look at like what you love and try to tie that in. So.
Yeah, that's great. Kevin, what about you for the biggest challenge?
There's so many, and there's not just one. But to simplify it, you all go through challenges every single day. It's absolutely no different in terms of whether you're a first-year PA to a 25-year career PA. You're going to encounter challenges, you know, every single day. Whether it's a patient that shows up at your office and unannounced, that is having some sort of emergent need overall, it's going to challenge you. And so going along, this journey of starting a new, company and a new, service, a new payment model, being able to, scale the company across the country. They're different problems, but they're no different than, what you all go through every day too. And so the reason why I say this is that it's not anything special. It's just different problems. What the things that are common is that you have to have passion for it. You have to have a grit to be able to break down those barriers, whether it be break through the wall, whether it be able to go around the wall or over the wall. You have to have that, and it has to be all the time. And it's kind of the James Clear book of Atomic Habits. It's being able to succeed, every single day. And if you can succeed, every single day, you look back, 90 days from now, 6 months from now, a year from now, you just plowed through a ton of stuff and made a lot of progress. And that's what you have to apply, to a new venture, starting a new department, within your organization or a new, position. It's about having that perseverance. It's about having that grit to be able to go after it, and really a passion to make a difference. And my passion and my fuel always is around improving the lives of patients, and whether it be from an experience standpoint, being able to drive better clinical outcomes, which then drives great clinical value. And that was kind of my North Star that really the whole company was about. And if we all kind of were focused on that, we could get a lot of shit done, that was needed to be able to grow this company, to be able to provide greater access, to care in the home. So.
Yeah, I think something to take out of what Kevin says, and our team says this in CM&F Group, is just the compounded nature of consistent action builds over time. And it's really like the small things compounded, and you get that muscle reflex. There's different ways with James Clear and everybody else with Atomic Habits, but you just have to be consistent. You build it over time, and it's just amazing where you go. Whether it's training for a marathon or a half marathon like yesterday, or it's building out a business, or how do you treat each patient in different areas and not have a confirmation bias to make sure you're leading them down the wrong road. It's all kind of iterative and consistently bringing your best each time. Okay?
So there's the term boiling the ocean. Has someone heard that before? So going into fundraising, there's a few things that you'll hear people say. One is like, you don't want to boil the ocean. Another one is MVP, minimal viable product. So I think us as PAs, we're very altruistic, right? We want to change the world. We want to help everybody. We don't care what it takes. But when you're actually starting a company, you have to actually show that you're super focused. So when they ask you questions, oh, can you do this? Can you do this? Yes, but not right now. I'm focused on my MVP. So get that in your brain. If you're ever talking to someone in venture, you are not focusing on a million things. You're focusing on what is my minimal viable product to ultimately solve and create now that will show that this is something that can be a profitable business model. And just like us as PAs, we also don't want to charge anything, so we want to give everything away for free. And the problem is that then there's no revenue to actually create a company that will ultimately change the world. So when you're selling, you want to make sure you're always thinking about who is your customer, not who's your user. Right? For us, we have two users. We have the medical provider and we have the patient. But our customer is the medical provider's office. So we really have to think about how are we selling this to them. So when you're presenting to a venture group and you're saying, these are all the problems we're solving, think about why would somebody buy your product? So once again, it all comes back to MVP. And if you can think of that and get it drilled in your mind, and you're making a cup of tea, you're not boiling the ocean, you will succeed.
Yeah, that's great. So kind of getting to our last question, and we'll pop into Q&A. So, and we'll just go down the line. Each of you, if you could give one opportunity that you see in the next 3 to 5 years, there are opportunities for the audience, even potentially yourselves.
Well, I think like now is if you have thoughts of wanting to start something, I mean, I do think it's a great time now. My background is in clinical leadership, and I led big teams of nurse practitioners and PAs in the past, and was like really obsessed with how do we utilize the workforce well so that we can do more for patients and do it at the best cost. And I think there's a lot of upheaval right now in healthcare, and I think there's a big focus on how do we do things more efficiently and bring new solutions to the table. And I think that the atmosphere is very ripe for change. So I think if you have an idea, now's the time. And I also think there's more PAs out there now than there ever was before. And so we're not new. I mean, when I started, it was 2006. I know I look so young, but it was 2006, and we were the first PAs in the hospital I was at, and the nurse, the charge nurse in the ER that I walked into was like, you guys aren't going to last here a month, we don't want PAs here. And I was like, I'm going to prove you wrong. And we did, but I don't think that's the atmosphere at hospitals anymore, hopefully. And so I think that, the healthcare system generally wants us, and there's a huge opportunity out there. So, and we're awesome, we're smart, we're capable, and we do things efficiently. So I think that also there's a huge need for tech. So there's a digital solution with a clinical backbone that can deliver efficiently, and you can go to the sky.
Cool. Yeah, Raquel.
So I think the really unique thing about PAs is that we didn't start, most of us didn't start our careers being in medicine or being a PA, right? We had experience doing something else first. And so we have a lot of different skills. And so I think in the next 3 to 5 years, obviously, a lot of the opportunity is probably going to be in AI and technology, and I think there's a lot of PAs here that could probably get into that. But we just think about yourself and what kind of skills you have. If you're creative, obviously you can do something with that. I've seen PAs do so many cool things with their skills. I see somebody in the audience, her name is Tracy. She's really great at the podcasts. Just take that, just hone into yourself. What are your values? What is your passion? And I'm sure that you have another skill that you could utilize to make a great opportunity for yourself and for the PA community, the healthcare community. So that's my advice.
All right. So I'm sure every one of you are amazing clinicians and deliver amazing care to patients every day, but the U.S. healthcare system sucks. I mean, it's really, really bad. And if you look at the amount of money that we spend, $4 trillion, every year to be able to take care of, our population. If you look at some of our readmission rates at 20+%, 30 days after they leave the hospital, the amount of patients that are ending up in the emergency department when they really don't need to be. There's so many opportunities to improve the way that we're delivering healthcare. And so that's the opportunity, is being able to decrease the costs, of care, being able to improve, outcomes, improve access from a health equity, standpoint, being able to create more value, in the industry. That's the opportunity. And, the opportunity is not about, the tech companies on the West Coast or the East Coast. It's not about, physician A or nurse B or NP C. It's all of us, really working, at improving the way that the industry, works, and it includes all of you. And so I think that's the mindset. And if you have a passion and an idea, it's about taking that leap and moving forward and, making healthcare better.
Yeah, Jared, what about you?
I think that we're all here to solve a gap, right? So what I encourage you is every day, instead of getting upset about something, write it down like on your notepad in your phone and think to yourself, okay, like just keep a list of like, what are all the things that bother me? So like going, for instance, to like the hair salon, you're like, gosh, if there was just like a way to like make it so it's not so uncomfortable when I put my neck back that I'm more comfortable, maybe there's a person. I always wanted, I have a friend that's doing chemo, I'm like, why is there not somebody here doing people's nails? And right? Like all the things that you're just starting to observe in the world, not necessarily even in medicine. Then you start to train your brain wow, I can turn this problem into a solution. And I think that's the moment when you start becoming innovative. There's this really cool, I think it's called sparkrocket.com. Don't quote me on it, I think that's what it's called. But you can literally put in a title or a description of what you're thinking, and it'll create a whole entire business plan for you. It's crazy. In 30 seconds. And then you need to also go start checking, is this something that actually already exists? For us, there's already apps that are out there for tracking your food and doing nutrition. But is there something that's collaborating with your doctor, that's providing nutrition support, that's getting so you kind of have to think about how niche can I make what I'm doing first? But think big picture, what is this thing that is just gosh, this could be really nice if. And then I think you'll start really succeeding.
Yeah, those are really, really good points. So we've got plenty of time for questions for the Q&A, so we'll kind of kick into that. And I'll kick off with one question that we got yesterday that I think the panel will be really good at giving some varied answers to, and then we've got one question in the back. But the first question that we got yesterday, and it's how do you get funding as a PA? Because when you go to certain banks, you're not seen in the same lens. And now that's a really critical question on, of course, one of the answers, which I'll kind of answer this piece and I'll kick it to the four of you, is, well, you can bootstrap it. So, we had, two of them, actually all three of them, doing work primarily and then in the clinical side, and then having that side hustle that they're kind of slowly tipping the scales to how much effort they have in their primary role versus the side hustle. So that's one aspect of it. But there's other funding opportunities, and each of them have gone through this. So I'll kind of stop there. Do you want to start off, Karen?
Sure. So our company is now a seed stage company, which means we are venture backed, but we didn't start there. So we started with we did a little bit of our own money, and then we did a friends and family round. So we raised some money with people that we knew on a vehicle called the Safe, which is a little bit like a convertible note. And that's essentially when you go to the people that you know that have money and you say, do you want to invest in this idea? And and they say yes or no. And it's very likely to fail, but you have to go in there very confident. And then you create your MVP, and you go to venture firms that are aligned with the mission of your company, and you start pitching your idea. And that's how we raise money. We're actually going into another funding round. I'll say I did an accelerator program that was a culmination of a bunch of medical facilities, and one of the mentors there, I don't know what the role was, but he was a physician, and he's like, oh, I think this is such an interesting thing that there's a PA founder. Like, this is really, really neat. Like, it was so crazy. And but I think that clinical people have a unique ability to do this, and I think, you know, where we're at and where our salaries are at actually puts us in a good spot to be able to take that risk and take that leap. It was tough, but I think it's tough for all founders raising money, not just PAs.
Yeah. Feel free to
Kevin's raised a lot of money, so he can
They
talk
know a
about
lot
that.
more about raising money than me.
Yeah, I mean, I echo. It's not about PAs. It's everyone. If you look at the, you know, where the market is right now, it's not the most favorable time to raise capital unless you have this big, you know, AI, you know, focused solution. And you know, we could have and talk about raising capital for the next 2 hours right now, but you know, I think it's really about the person's situation. You know, whether it's, you know, being able to get a small business, you know, loan at the local bank, it's definitely an opportunity. You know, to being able to raise capital from friends and family, to bootstrapping. You know, that's how we started. You know, is bootstrapping and doing things, you know, on the side along with our daytime jobs, until we got to a point where we had enough patients that we treated with enough clinical outcomes that we could confidently go to other, you know, entities to be able to raise some capital at that time. And you know, as you have more and more proof points from a, you know, patient standpoint, from an outcomes, you know, standpoint, you're able to potentially generate more capital moving forward to allow for continued growth. And you know, whether you're a pure tech or a pure SaaS play is going to dictate whether you know, how much you raise, you know, versus a tech-enabled, you know, solution. Are you actually a practice that you're starting, which may need a little bit more capital to be able to fund those clinicians? So everything is a little bit different, and I'm happy to be a resource, to get on the phone and talk as a follow-up. So I don't know if you have access to emails, but happy to get my email out to anyone.
Yeah, Gary, close us up on discussion.
Yeah, I just think that don't go, like, unless you actually feel compelled to be the person starting this company, don't feel like you have to be the one. You can also go and see, like, is there a startup that's already doing what I'm doing, or is there a company that's already doing what I'm doing? Can I just be like an advisor for them and kind of see maybe through the window what are they doing before you jump in and do it, because there is a very high failure rate, and I think that it's really important to think through that. Just kind of talking more about the funding thing, we're also a public benefits corporation, and I just learned about a donor advised fund that allows foundations to actually be able to invest in mission-driven companies, that they can invest through the donor advised fund and invest in us, which is really cool. And then there's also ways of people actually being able to like donate to the donor advised fund and say, like, I'm supporting moms. So I think it depends on kind of what type of company you're creating. There's also, you know, the venture route that we're also going, but it's really hard. I think you have to speak to like 80 ventures before you get a guess. So yeah, just try to make this thing that's going to cost the least amount of money to show some sort of moving the needle on something, and what is it that you can actually quantify that you made the difference in.
Yeah, amazing. So I think we have a question in the back. feel free to grab the microphone and so everybody can hear.
I started a business last summer, which is not unique. It is going into patient homes, providing IV fluids for various conditions, whether that's hyperemesis, dehydration from being an alcoholic, who knows. But going into their homes, providing migraine relief, I didn't say that already, but do some IV fluids, put some medication in their IV fluids, and they're an hour and a half on to the next patient. And the idea that it is going to be a quick turnaround, an hour and a half or so, to give them treatment, cash-based. The biggest problem I'm running up against as a PA is that we can function independently, but I can't get supplies from anyone without having a physician on staff. Has anyone come against that, come up with that? How to get around it?
What state do you? Utah. You know, I think there is some, and that's, we're not going to be able to change that, you know, today at all. But that, you know, obviously is something that we need to continue to push in terms of advocacy efforts, blah, blah, blah. But, you know, in the meantime, there's many friendly physicians out there, and, you know, encourage you to potentially, you know, find kind of a partner around that is not going to cost, you know, a lot of money for you, but allows you to effectively get past that hurdle and to continue to provide greater access to your service. And so that would be the best. And I think maybe there was one actually here that was actually it was yesterday, single aim.
Yeah, single aim.
That would maybe, you know, someone to think about. But there's a lot of, you know, friendly folks, you know, out there to be able to connect with about that.
Yeah, I think giving like two partners that CM&F Group works with. Number one, single aim, which Phoebe, you can feel free to like raise your hand and just wave.
Oh, right there. Look at that.
She's in the crowd.
Yeah, look at that.
And then we also work with National Association for IV called AAPA, and they're kind of like founded by healthcare attorneys specifically, but that's also part of their resources is pulling in like what are the needs. So if you've got single aim, you can ask them in person like how they kind of work with that. Sometimes you have MSOs that'll kind of like provide something like that to you, and you're kind of built for that. Other times you have physicians, and then you have platforms like single aim kind of answer out.
In Utah, you have full practice authority though, right? But you can't get supplies.
The companies don't recognize us. They want a physician license. I have a CLIA license. I have a medical business license, a tax ID number, everything but a physician.
But that's not something that's in the law, is that the barrier in the law?
It's with the businesses.
So
Yeah, so that's interesting.
supply chain partner that.
Yeah, so that's interesting because like Raquel's saying, and you understand, it's an optimal practice state, so therefore you should be able to be reimbursed like directly, which means you don't need the interceding physician, but like you're saying, businesses are making decisions based on what they think, not necessarily from like a payer or a CMS like provider standpoint. That's a really interesting problem, and I would imagine it's pretty common.
They just have to advocate and understand. There's that.
Well, I think
Or it's,
Yeah.
you may even want to,
Do you want to pass the microphone?
I don't know what supply chain, you know, groups you kind of reached out to, but we can certainly take this offline, but it doesn't, and I'm not an expert in the, we just raised capital just to have legal help on figuring out every state and the differences, you know, there, but if it's a full practice authority, we shouldn't have really any issue, and it's a matter of getting to the right, probably an individual at those supply chain companies to be able to contract appropriately. So,
And someone mentioned knocking on 80 doors. I need to go that route.
yeah.
Push forward.
Yeah.
Well, hopefully there's a couple doors you can just knock on that we can connect you to, and then that'll solve the problem. Yeah, thank you.
Dispatch Health, I actually applied to your company in Oregon. It's
Oh.
really neat to meet you.
Nice to meet you. Yeah, and we just expanded in Utah. So,
All right, next question.
Hi, I'm just kind of piggybacking on her, and I do want to talk to you later. But for those of you who might apply to, do you have to have a collaborator? And if so, how involved are they?
So we have a medical practice. It's physician owned, and we have an MSO. So that's the setup that we have with our company. In New Jersey, you have to have physician owned medical practice.
and every one of our practices at Dispatch Health is physician owned, and it's depending on the state, but each medical practice is a separate entity across the 30 plus states that we operate in. And so, but we have individuals that are multi-state licensed, so, physician leadership that, holds 50 state licenses, and so they have the opportunity to be able to start new practices in those states.
Yeah, good question. Next one up.
I just have a question about, I think it's scary when you go from, like, you work at a hospital and whatnot, and then leaving that security of having health insurance and whatever else, to now owning your own business. And I know some people talked about yesterday, the speakers, that they do still work part-time or whatnot, but I was just wondering if you guys could talk more about that, like taking that leap, or do you still try to work part-time or as little hours as you can to keep those securities in mind?
I'll just quickly, I'll speak to when I did make the leap. I made a leap from that startup that I mentioned, to starting Dispatch Health, and there was many months where I was bringing in no income at all, and a very supportive wife, and network around me that supported, kind of this vision, but it was scary. But it was a leap that I felt like I had to take and try. And at the time, I think my twins were 2-year-olds when I decided to do this, and but it was just something I had to do, and it was having a supportive network around me.
I definitely can speak to this. I have a 15-year-old daughter, and I started my company, and for the first couple months, I was working on the weekends, doing a couple shifts, and it was it quickly became apparent to me that if I really wanted to build something that was going to scale and really make system change, that I couldn't half-ass it. I had to jump all in. And it was a risk that I was going to have to take to truly just jump in and believe in myself. I have my clinical degree. I can always go back to where I came from. That job is still waiting for me. But I couldn't do this and do that. It wasn't fair to the company. It wasn't fair to the people that I was hiring. It wasn't fair to the people that had invested in me. And I took the leap of faith. There were weeks, the first year that we started this, there were weeks that we didn't go grocery shopping. I was like, we got enough food in the freezer this week, we're gonna eat that in the freezer. And that was really different for me. But I was so passionate about what we're building, and I really believe that we have something that's gonna change things for people in the future of healthcare. And I think that's much bigger than anything. But I will say, my sister is also a PA, and she's a couple of years younger than me. And I tried so hard to get her to come do this company with me, and she is just too scared to leave the safety of her hospital where she works. And I have a lot of opinions about the way they treat PAs. And I think just that security, she has a lot of fear about leaving because she's the primary breadwinner for her family, so am I. But she just didn't want to take that leap of faith. But that's okay. I think there's a lot of right ways to cut cake and you still get cake. Like, you know, this is super high risk and super high failure rate, and you know, it's not the right thing for everyone. But I don't know that you could jump into the startup world and not give it your all.
Yeah, one thing, I think we got 2 more questions we could hit, but one thing to just remember is that, you know, it's harder for you or clinicians, but you know, you're not the business that you start. You know, what you're trying to do is scale out the ability to help more people. You kind of started out, everybody was kind of hitting on this commonality of like delivering on a mission. You know, it's really like what each of them have. And, you know, that scales out over time, and it's something that you should really be proud of if you can leave behind and have somebody else kind of carry the torch. Or if you join a startup that you see like a new vision of something else, you know, that you see and you're like, you know what, there's another problem I can help with. I think you want to be okay with failing, you know. At a certain point, you need to be okay with that because it is a high failure rate. That doesn't mean you're a failure. It means the business is. So just want to temper that. I think that's a good thing. It's just like remember, like you are your worth because PAs are needed everywhere in the country. You have that ticket. Somebody said that yesterday. You have a ticket to go back if you need to because you're in such high demand. And I think that should be something that gives a little pause and hopefully like comfort level on the next step. Anthony, do we have one more question? We've got 2 up front. We can finish with the 2.
So let's say you see this problem, you say, I think I have a solution. And you come up with this whole concept of what could be. Who can you trust to talk about it with? Who can you've researched it on the internet, hopefully Google is not identifying what you thought about it and spreading it somewhere else. But all right, you've researched it, you can't find it anywhere else, and you think, all right, there may be something here. Because I thought of the dual flush toilet way before they came out with it. But, you know, it is what it is. So you're scared, you don't know who you can talk to, and then you get busy with life. So how do you take it from idea, because I'm sure there are millions and millions of wonderful ideas every day that go absolutely nowhere. How do you take it from an idea to who can I talk to you know, who can I partner with? Because if it's a tech solution, then you need a programmer. If it's a device, you need a prototype developer. How do you get from idea to that?
What I've learned is everybody is so scared about talking about what they're doing because they're worried someone's going to copy it, but seeing how hard it is to actually execute and develop, I think honestly being comfortable having conversations and just, you know, not maybe giving away your secret sauce, but presenting it as a question or something like that is always a good way. But when you, for instance, when you're sending out your deck, you're just kind of unfortunately having to trust that no one's going to sign an NDA. So you're kind of having to trust that you've come up with something that's good enough that it's going to be able to be lasting. I'm not sure if you guys have any other thoughts on that?
Yeah, no, I agree. I think originally it's being fearful, you know, that someone's going to take the idea. To Carrie's point, it's much harder to execute, you know, on the idea than to come up with an idea. And so it's really how are you going to, what is the right path to be able to execute? And if the right path is to be able to talk to Mike Smith over there or, you know, Joe Smith over here from a, you know, tech standpoint or from a business development standpoint, go ahead and have the right, you know, discussions. They may end up being your future co-founders, you know, because of the collaboration, you know, or the shared vision, you know, around it. And so I feel very, very comfortable, you know, talking about stuff because it is very, very, very challenging, you know, for people to actually execute on it.
I just want to add something a little. I could not have done what I've done without the people who I went to with my ideas, advice. I have so many people that I consider mentors, and a lot of them aren't even PA moms. They're not even female, they're male. They've been super helpful, so don't be scared to talk to people. And also, there's a lot of copycat PA moms groups out there, and like they were saying, I just think it's really important what your mission is, being really focused on that, and the culture of your organization and what your product is and what you're bringing out there. That's super unique, and so you really don't have to worry about any of that stuff if your product is like super unique and you're running it really well. So
just a little, I totally agree with all those things. Execution, not many people can do that, but also if you have an idea and you're like, well, I have like piece A, but I don't have piece B and piece C. I think for like the Dimer Health story, like it's a story of serendipity. And my co-founder is also a PA, but he became a PA as a second career. His first career was in tech, and he had a successful exit. And then in his boredom decided he was going to drive an ambulance around his town to teach his kids how to give back to society. And they told him he had to get his EMT, and then he did, and then he got his medic, and then he was like, well, I'm old, so should I go to PA school or med school? I'll go to PA school. And I met him as a new grad before, I think right as I finished my treatment for my breast cancer, and I had no hair when I met him. And we had this like conversation about the future of healthcare and said, well, we should do something together one day. And then COVID came. And then 5 years later, I was operationalizing all of this work in readmission avoidance and ED diversion. And I reached out to him to tell him, oh my gosh, I'm so proud of you for doing startup, it's so hard. And he said, oh, I'm getting my doctorate now and using technology to reduce ED revisits. And we're like, well, this is cool, we should get coffee. And so I had the operational experience and he had the tech experience, and like Dimer Health was born. So sometimes it's just being open, being ready and ready to receive. So I love that story, it's so cute.
I think that, just from like and we can get the next question queued up. I think from just like a legal standpoint, there's a tipping point where you go from like theorizing to actualizing, and like with a lawyer background, every contract you set up with the anticipation that it ends. And you should make it very like the way you want it to end, because the reality is when things go bad, you just want to be able to walk away with as minimal damage to you, your business, the other person as possible. And so there is a certain point where you want to say, okay, I'm working with this coder. Is there something super special in this that I'm providing from the clinical side and this idea that really like I need to have self-contained? But that's when you start talking to a business attorney and you start thinking, okay, we're creating this LLC. Everything in the LLC kind of stays in the LLC as confidentiality, non-solicited, whatever the case may be. But executing is like, we do liability insurance. We've been doing this for like over 80 years. It's a new entrant, like every year, like we're gonna do this thing, and it's gonna be amazing. It's like great, and it's cool because you actually learn what they do. They ask us what we do, and you just learn. And it's like, listen, at the end of the day, like you have to execute. And we all know organizational problems in healthcare or any business. There's people who can execute, there's people who can't. And good luck when you go out in the marketplace, because you have to build a relationship and execute and have a good idea and a product that actually is like commercially viable all at the same time. And you have to not lose sleep over it. So it's like if they want to run that race, it's exciting. I hope they do well, makes the market better. Last question.
So my question is kind of similar to prior one, is how did you go from idea to implementation? What resources did you use? I know we've talked about mentorship, we've talked about funding, like were there any books or things that just kind of changed your mindset from that, being in a very comfortable place where you were at, but where you really knew that you want to be that entrepreneur? What made it click for you? What resources did you use?
I'll be really quick. I I was working at a startup, and I was like, there's no way I'll work this hard ever again for anyone other than myself. But while I was there, I was like a sponge, and I was watching the finance team, and I was watching the M&A team, and I was watching the sales team, and I was watching everyone like a hawk, because I was like, this I'll never do again. And if I ever do it again, it's for myself, and I want to learn everything I possibly can. So I just made everyone, and I've been that way my whole career, like everyone is my teacher, and especially there though, because I didn't want to learn any of those lessons twice.
Yeah, I think it's being able to have a great network, around you. I echo Carrie on that previous startup had some success through the acquisition of Aetna, which allowed you to be introduced to many more people, and you create relationships, and from those relationships, you build confidence around doing things. I'm also a just super geek on reading anything that I can to be able to continue to improve and learn. Whether it's in the specific niche of the industry, you're in, or adjacent segments of really understanding everything about the market. I think that's critical, just to be, a sponge on whether it's things you don't know or things that's, one company or leader having success here, how can I learn from them to apply it, which then builds, confidence. And so those are, a couple different ways that I went about it.
Great. Listen, just wanted to say thank you. Benjamin, you seem like you really want a question that you got to ask. So go ahead and get this question, and then we'll close up. But thank you, everybody, for coming. We're up at booth 1211. Feel free to pop by and say hi. Unless if we can help you in any way. Benjamin?
Thanks, I'll try to be quick.
No.
Good to see Dr. Rockman. We saw each other at MSC graduation in 23.
Yeah.
Happy to see you're successful. So I have an integrated business practice I'm going to be opening shortly. I have a 14-page business plan. I've got the market research studies. Also, I've got the independent practice authority through North Carolina Medical Board and the Secretary of State already approved. I have paid for the domain. I'm ready to open the door. I need investors. The conversations I've had with friends, family, even private investment groups in the area, I get a lot of buy-in, a lot of talk support. As soon as I start to say, I get people kind of falling back and not continuing that conversation. So I might not be the greatest salesman, but what can I do to maybe sell the business in a way that I'm not currently being successful with, just asking friends and family, without going to a venture if possible?
A friend of mine, if one of you want to answer, a friend of mine does a lot of serial entrepreneur, and he's done tons of sales. And one of the things he says with the friends and family is, picture like the nicest Disney vacation you can make for your family, and that's the most amount of money I'll take from you. So he kind of caps it at like 10, 15 grand is kind of his, like, for a 4 or 5 person family going to Disney. And that's like it. So if he gets people who are like a third cousin and they like really want to give him $100K, he says 15. Because he feels at the end of the day, hey, it's like a really nice vacation, not like your long-time savings. So that's one thing that he's kind of given out that I think is interesting. And he mentors people at the University of Notre Dame for startups.
So I learned you always think of the end, and then you work backwards. So ultimately, what is your goal? Are you trying to sell this? Is this going to be a business that is going to support your lifestyle? Because ultimately, you're convincing people to put their money in you instead of in an investment. So you need to show them that them putting money in you is ultimately going to lead to X. So look at comps of companies that are similar to yours that have sold. What was their ARR? And then ultimately work backwards. How do I get to that point?
Yeah, it's a great way. Like, how much money do you think a trade at T-Bond is going to make in marketing? And then over that time, they are, kind of going through those methodologies. Anybody else want to answer that before we close up?
I'm sorry, I missed the actual practice you're building,
Sorry, what was
but
that?
what type of practice were you building?
Integrated medicine.
Okay.
So integrated medicine.
I mean, one thing that I would encourage you to do is there any way of just starting to see patients on your own dime? And, you know, whether that is through a virtual means, low cost, being able to get some patients in the door, being able to get some stories associated with that. You get some patient stories, that goes a long way, you know, with being able to grab the attention, you know, of folks, that to be able to then, you know, scale. And so that would be my, you know, advice of the best approach.
Yeah, so just a couple thoughts to close up on that. That's where like the relationship building, referral process, and things like that come into play. So I mean, not to be like flippant about it, but I mean, if you went into a yoga class and worked out there for the next 3 months, you would probably find a lot of people who want like functional medicine and are a little bit more like, you know, on the forward thought process of like proper nutrition and eating and integrated functional medicine. If you work with an RD that's local, working with obesity patients, things of that nature, you start to find like collaborations that can build the base and get those testimonials like Kevin's talking about, and get that MVP, so to speak. Okay, I got the 14-page business plan. This is what I'm going to need to really like get out there. But like you can start mobile and basically have no brick and mortar, which is usually a massive cost. And you can just start cooking right there. And then you build that up, that MVP, and then you go out and you say, hey, this is what I've done with these like 15 people. Now I'm at 30, now I'm at 50. And, you know, maybe that's kind of what kickstarts it for you. But yeah, thanks everybody. Thank you to the panelists for doing it.